Hi, everyone. My name is Brooke Rollins. I am humbled and honored and frankly, every day, so inspired and excited to lead the America First Policy Institute. Our organization is brand new, but in just a short time, we have already begun to change the game. And building on the last 4 years of policy transformation, of putting Americans and America first, whether that is in the economy with jobs, in education and national security, and really every issue. We're here to talk about what that means in healthcare. And what an honor and how grateful I am that the incredible former governor of Louisiana, Governor Bobby Jindal, is here with us to serve as chairman of that center, and also Dr. Heidi Overton, who will serve as the director of that center. We all know and have all seen the epic debates and battles that have gone on in this country for a long time on the future of healthcare. And we all know that there are two vastly different visions for what that looks like, depending on what side of the ideological aisle that you come from. But I think there's no doubt for those of us from Louisiana and from Texas and from states that believe in freedom and putting the patient first and putting the doctor first and moving government out of the way and seeing firsthand what the concept of the laboratories of democracies, the states, have done in that lane, what truly can be done to put Americans first in the healthcare lane. So again, we're so grateful to have Governor Bobby Jindal, Dr. Heidi Overton, the amazing team that we'll be building out as we continue to focus on putting America and Americans first, and certainly within the Center for a Healthy America. So we'll start with Governor Jindal. So tell us about your background. You obviously need no introduction, but you really do have such an incredible depth in this issue area, and really how you came to be interested in it, some of your focus and work, and frankly, achievements in that space.
Well, Brooke, first of all, thank you very much for the invitation to work with you and Heidi. I'm thrilled to be with you. You did such a great job in that introduction. I'm not sure what more we need to say. That was a great summary of the center's work. I hope everybody gets to hear that. Look, my background in healthcare, it starts many years ago. My parents came to this country in search of the American dream. And I don't have time to tell you their entire story. Just know that my dad's 1 in 9, the only one that got past the 5th grade. My mom was pregnant with me at a time when there were no cell phones, no internet. They come halfway across the world so she can go to LSU. He gets his first job out of the Yellow Pages. When they have me, they don't have, their insurance doesn't cover me. I'm what you would politely call a pre-existing condition. And so I've been called worse. And so they literally negotiate a payment system where they just send the doctor a check every month. There's no paperwork, there's no contracts, no government programs. What excites me about their story, what always amazes me, even every time I think about it, is they came halfway across the world to a country they'd never visited. They hadn't been on a plane. They'd never been out of their home country. And they came here not because they knew anybody, but because they knew if they got here, and if you worked hard, you could have a better life. And that's really what animated and motivated them. That's what I want for my kids. One day, that's what I want for my grandchildren when we have grandchildren. That's what I want for all of our children. But like many immigrants, my dad, he wanted his kids to be doctors. And we could study whatever we wanted as long as we were doctors. He said that was, I remember when he sent off to college, neither my brother nor I became a doctor. But from a young age, I've always been interested in healthcare. And so I've studied it in school. I ended up, we were just talking, I took a job at a young age. I was the healthcare secretary in Louisiana many years ago. I later went on to become the executive director of the Bipartisan Medicare Commission right here in D.C. when President Clinton was in office. We came up with the ideas that helped shape the Medicare Advantage marketplace and premium support. I would later then go on to become an assistant secretary at HHS under President Bush. I've worked in the private sector on healthcare as well. I continue to do that to this day. I was obviously a 2-term congressman, a 2-term governor. But this is what's really motivated me. And you know, it's so easy to get confused in healthcare. People that work in healthcare, they talk in a lot of acronyms. And you go and it's alphabet soup, right? And you hear about all these government programs. You hear about CMS. We used to call it HCFA. You hear about HHS. And then you hear about FMAP, the Medicaid matching rate. You hear about Medicaid. You hear about Medicare. You hear about ERISA plans. You hear about the ACA exchange marketplace. And it's really easy to get overwhelmed. And you go down the street to the Capitol, and whenever you hear them debate, they talk about trillions of dollars. And they talk about, the Democrats tell you that we're going to, Bernie Sanders, he's got a very clear vision, right? It's very simple. The world will be a better place if we just let the government run everything. Get rid of all that for-profit, get rid of all that messiness. And it'd be a lot simpler if we just took away choices. Let's spare the American people this idea of having to choose your doctor or choose your procedures. We've got a very different vision. And look, there are a lot of numbers, there are a lot of complicated acronyms and rules and laws and regulations, but it's really, really simple. All you got to do is answer one question. And that question is, who do you want to be in control of your health care? Do you want it to be the patient working with their doctor, or do you want it to be a bureaucrat? AFPI is all about making sure it's patients working with their doctors, not bureaucrats who run our health care.
It's really amazing to see all you've accomplished to date, and what's really exciting to me is how much more we're going to be able to do together for the people of this country. So thank you so much, Governor.
Thank you.
Dr. Heidi Overton, so great to have you. We worked together in the White House on many healthcare issues together. Yes. Your background's pretty special, and I think what you bring to this conversation and your leadership to this center, I'm not sure there's anyone better in the country to do what you're doing and to take the leadership role on. So thank you for that, and love to hear a little bit about your background and vision too.
Yeah, well, thank you, Brooke, and thank you, Governor. It's such a privilege for me to get to work with both of you in advancing healthcare, really healthcare freedom in the country. I grew up in Gallup, New Mexico, the daughter of a pastor and a homemaker turned nurse, and so a heart of service was really ingrained in me at an early age. And I was drawn to medicine to be able to help people, and just had really interesting experiences along the way. I went to the University of New Mexico for undergrad and medical school, and during medical school I got appointed by Governor Susana Martinez at the time to be on the Board of Regents, and found myself as a third-year medical student also a member of the hospital board of trustees, and would go around on patients early in the morning and then go to the boardroom. And New Mexico's a state with great disparities, great beauty, amazing people, and I got to see firsthand some of the differences and the discrepancies between boardroom conversations or policy conversations and what I was seeing when I would walk into a patient's room at 5:30 in the morning. Yeah. And that continued as I went through my surgical residency at Johns Hopkins. I started doing some research work, and we found patients who had been bankrupted by medical bills. And what was so shocking to me is that no one goes into medicine wanting to put patients into financial bankruptcy. You go into medicine to help people. That was my heart. When I first started my journey, there were no doctors in my family before. I was very new to medicine. So to be a practicing physician and start seeing, the other side of how patients are impacted by our healthcare system was really a jolt for me, and that's what really led me to want to jump into the policy conversation. And my time at the White House really reinforced that, of saying, where are opportunities to bridge the two worlds of policy and medicine? And so for me, the opportunity to lead this center with both of you and to continue my work in medicine. I've actually transitioned from surgery to pursuing preventive medicine and population health, in large part because of our experience with COVID at the White House, and recognizing that there are so many issues within our healthcare system that need our attention. And so for me, this opportunity and this center is trying to be that bridge. How do you take what patients and doctors are experiencing in the exam room, in the hospital, in the clinics, and out in the communities, and provide real policy solutions that are focused on them? And again, to your point, not bureaucrats who are sitting behind desks who've never been in that position. So I'm really honored to be here, and I think just so excited actually about the potential for us to make an impact with so many others in the country. We'll hear from doctors and employers who are taking this challenge on head on as well as state leaders. And so I think, there's great partnerships to continue advancing this goal together.
Well, that's incredible. And I know today the two of you are going to be talking to some other governors around the country who have been really on the cutting edge of leading on this issue. I know you're talking to some physicians, you're talking to some patients, really bringing the full square together of who it is and who we need to frankly work with as we're fighting for the future of this country. And there's no doubt, as a mom of 4, I know a dad of 3, Heidi a future mom, that those of us with our families and our nieces and our nephews, there's no one issue that arguably touches more people's lives than our healthcare system. And so as you're sort of moving into the conversations for today and frankly into the vision for the future for the Center for a Healthy America, how do you see this moving forward? I mean, clearly in Washington, we're in a different place than we were just 6 months ago, with different belief system in the current leadership that do believe that the bureaucrats or the government should have more control. But then you look out in the states, and I know some of the governors you're going to talk to today are going to talk about how they can basically within their states become models for really good policy. So I'd love to just hear your thoughts on what that looks like and what we can do to work together to try to fix the system.
Absolutely. Well, and Brooke, first of all, you said it exactly right. Look, health, it's the great equalizer. When you're sick, it doesn't matter if you're rich or poor, young or old, doesn't matter if you're male, female, black or white. None of those things matter. You just want to get better. And I always tell people, when you're in the back of an ambulance, you pray to God, this isn't your time. I tell people, if you're religious, you pray to God. If you're not religious, you get religious. That's that moment where you do anything to get better. Look, I'm excited to be able to work with Heidi and the rest of the great team you're putting together at AFPI, and I'm excited about the conversations we're going to have with these governors, these patients, these doctors. I think there are a couple of things that we can do that aren't being done today. One, we can help advance proactive solutions at the state level. It always frustrates me. The mainstream media will tell you, well, conservatives just say no to everything. And that's simply not true. Right. You know, for the left, it's really easy. They simply say, oh, the answer is to tax more, borrow more, regulate more. They claim victory when they say, well, we've covered you because we put you in a government-run, a top-down program. That doesn't really solve the problem if you've got high deductibles, if you have a tight network where your specialist isn't covered. What really matters to you is, can you go see the doctor you want? Can your child get the prescription they need? Can you get the preventative care to keep you from becoming ill so that you can continue to work, you can continue to live your life? So at the state level, I think AFPI can play a leading role in advancing great solutions, whether it's telehealth, whether it's expanding the scope of practice, whether it's these competitive coverage products that can go around the ACA. I think that there's a lot of great work we can do at the state level to show that healthcare can be affordable, can be high quality without Washington. And it's not a one-size-fits-all solution from D.C., but rather a bottom-up approach led by great governors like some of the ones that we're going to talk to a little bit later. The last thing I think we can do is, look, the left here in D.C., Bernie Sanders and Joe Biden and the rest of them, they want to continue to spend and borrow more. They want to get to a single-payer system. They probably can't get there overnight, so they're going to keep taking small steps, one at a time. But these are big steps when it comes to loss of autonomy, loss of our tax, our hard-earned dollars out of our pockets, and it's going to be hard to roll that back. So one of the things we can do is show people the real cost. You know, I bet you a lot of these governors are going to talk about, like, we're going to be talking to a couple of governors that have not expanded Medicaid. The left likes to call this free money. I don't know about you, but when I pay my taxes, it doesn't feel free to me.
That's right.
And when they borrow that money, my kids, your kids are going to pay that. Heidi's kids one day, they're going to have to pay that back. And so the thing that we can do is show that there are real negative consequences. The media's not going to do it. You can't count on the Washington Post, the New York Times, or those folks to do it. So AFPI is going to step into that breach and show there are real negative consequences to some of these policies. You know, I'll just close. You look at what y'all accomplished, what the country accomplished with Operation Warp Speed. Yeah. That shows what happens if you can get the regulations out of the way. When the public and the private sectors work together, when you have the right incentives, that was in the middle of an emergency. There's no reason we can't bring that same urgency, that same competence to improving health care for all Americans and really making it affordable. I think your average person will tell you, a lot of them, if they have access to health care, it's good health care, but it's too expensive. We're going to help shape policies that can help address that.
No, that was so well said, Governor. Thank you. Heidi, any quick thoughts on that?
Yeah, just to add really quickly, we're also going to be talking to some doctors that have come up with innovative solutions for these problems that patients have experienced. And, you know, you hear we want a free market healthcare system. But until you see that, until you see it in practice and how patients benefit from it, I think it's hard to understand that. And so, you know, doctors are creating their own solutions. We have employers creating their own solutions as well. And so there is so much more than just the government providing the solutions. And I'm excited for America to hear those stories. We really need to show people what it looks like when we say free market. It really means that you're in control. You make the choices. You have all the information you need. And so I look forward to getting to share those stories today.
I'm really excited to see the two of you together, your leadership, along with our chairwoman, Linda McMahon, and the vice chairman, Larry Kudlow, and really our incredible team at the America First Policy Institute, the work that we will continue to do together. So God bless you both for taking this on. Thank you.
We're here to discuss a monumental national achievement. From the instant the coronavirus invaded our shores, we raced into action to develop a safe and effective vaccine at breakneck speed. We're just days away from authorization from the FDA, at which point we will immediately begin mass distribution. As a result of this unprecedented investment, we are exceedingly proud that both Pfizer and Moderna have announced that their vaccines are approximately 95% effective. Despite the grim projections from the media 8 months ago, we did something that nobody thought was possible. They said it will never happen, you can never do it. It was a pipe dream. In just a few minutes, I'll sign an executive order to ensure that American citizens have first priority to receive American vaccines. We will soon end the pandemic, and we will save millions and millions of lives.
Hi, everyone, and welcome back. We're so glad to have you, and it is such an honor to introduce, as part of the program, the amazing 48th Governor of Texas, my longtime friend, Governor Greg Abbott, as we continue our discussion on the future of America, on the future of healthcare in America, and truly on a treatment plan for making a more healthy America. Governor Abbott, we're so glad to have you with us.
Thank you, Brooke. Thank you so much.
Greg, it's great to see you again. You know, I wrote a recent Wall Street Journal op-ed. You guys signed a package of bills, around healthy Texas, healthy families. So tell us a little bit about what you did, how you did that, because I'd really like other states to learn from your example.
Sure, a great question. And so we are constantly looking for ways that we can improve healthcare in the state of Texas. And part of that focuses on helping healthcare for everybody in the state, but also part of it addresses kind of a specific subset that you just mentioned, and that is Texas being able to, on its own, improve health care for those who are on Medicaid without Texas expanding into the federal-based Medicaid program, in part because it is so expensive and it's just a massive government program, and it doesn't give us the flexibility to meet the unique needs of our fellow Texans. And so we broke this down into multiple categories, and this was just one session of what will be many sessions where we were going to be able to improve access to health care, especially for either the uninsured or for those who are on Medicaid. Let me break this down into a couple of categories and tell you an example of what we did. One category is to improve access to health care for all Texans, but also for Texans who are on Medicaid. And one way that we did that was through the expansion of telemedicine. We had telemedicine in the state of Texas before the pandemic. However, during the course of the pandemic, we truly accelerated the use of telemedicine by way of executive order. The doctors liked it so much, the patients liked it so much, the legislators liked it so much, they passed a law now in the state of Texas fully expanding telemedicine to make sure that everybody, whether you are an insured patient or whether you're a Medicaid-based patient, everyone is going to have better, more robust access to telemedicine. Another category that we focused on was improving outcomes, healthcare outcomes for our fellow Texans, and especially those who are on Medicaid without us having to expand into the federal Medicaid program. And one quick example under that category is that we have an issue that we're working to improve upon, and that is the health of pregnant women and women who give birth, to also reduce the maternal mortality rate. And one way that we are improving the outcomes of that is before the law that we passed this session, mothers who give birth would be able to remain eligible for Medicaid for 2 months after delivery. And now that has been expanded to 6 months after delivery. And then a third category is, of course, one thing we always need to find ways to do is find ways to make healthcare more affordable for everybody. But get this, Bob, because this is really transformative, and this is the biggest issue that we can make sure that we are going to be able to expand access for those on Medicaid, as well as most importantly, those who are uninsured in the state of Texas without having to go into the Medicaid expansion program under the federal government. What we are doing is we are reducing the cost of prescription drug medicine for about 3 million Texans who are uninsured. And we're going to do that by giving them the same low rates that insured Texans receive. You may recall, or people may understand, that when they go to a drugstore and get a prescription drug, if they have insurance, they don't pay the high market-based price. They get a reduced price based upon rebates that exist in the system. The state is negotiating those rebates to make sure that the uninsured pay the same low price that the insured pay when they get those prescription drugs, and that is dramatically going to reduce the cost of prescription drugs for the uninsured in Texas.
Well, thank you, Governor, for such a great explanation and really amazing reforms. We just want to ask, if you're advising other governors who are facing similar calls for expansion of Medicaid, what would your advice be to them?
First is the issue that we constantly look at here in Texas, and that is, listen, if we opt into the federal Medicaid program and the expansion, whether it be the Medicaid expansion or the Affordable Care Act, we're kind of making a deal with the devil because of the extreme cost. People say, well, listen, you're going to get access to billions of dollars to help your healthcare system in the state, but few people focus on two facts. One is the states are still going to have to pay in what would amount to be billions of dollars to be a part of that program, and that is the early cost. That billions of dollars of additional costs borne by the state to opt into that program would do nothing but increase as we go forward. And something for your audience to know that a lot of people don't know, and that is the two highest cost drivers for a state budget are Medicaid as well as public education. And the trajectory of Medicaid is still going to continue to be a cost driver, and it could eat up most of the budget for the states. And so we simply cannot opt into a system that will be draining our coffers of all of our money. But I mentioned the deal with the devil because remember this important fact, and that is we may be paying billions of dollars right now if we were to opt into the program, but once a state opts into the program, they are stuck in that program and cannot opt out without losing all access to it. And so the deal is with a federal government that is already, about $30 trillion in debt and increasing even more as we go forward. What that means is the federal government does have the right to change the percentage of payment of the amount of what the federal government's going to pay for Medicaid. And I believe in the future, the states that have opted into the federal-based Medicaid program expansion, they will be paying a higher percentage going forward to remain in that program, and that will bust the budgets of the states going forward. Instead of going down that costly pathway, you don't have to just say no to it. You can look at the innovations that states like Texas are employing to make sure that we are doing a better job of providing expansion of health care for those who are Medicaid, as well as expansion health care for those who are uninsured.
Governor Abbott, I think that's so impressive, and I think your bold and courageous leadership is 1,000% right on this. I've been so proud to see Texas continue to carry the banner on that and that message and fighting for what's right for our people. Walk us through a little bit your thinking on how you have led the way on COVID and what that has meant for the state of Texas.
It's like a lot of other decision-making processes, and that is you have to establish priorities. And we knew early on the priorities that needed to be addressed with regard to responding to COVID, and that is first, to protect the most vulnerable, and that means the senior population as well as non-senior population of folks who have other healthcare issues. And if we could help them, whether it be initially through the testing process, through the isolation process, through doing in Texas not what they did in New York with regard to the nursing home situation, we would be able to reduce and contain the spread and exposure to the vulnerable population. Two is we wanted to focus both on helping to save and protect lives while also helping to save and protect the livelihoods of Texans who have to pay bills. You mentioned mental health-based issues. You have mental health-based issues for those who are unable to pay their bills and keep their businesses going, as well as mental health issues for those who are in isolation. And so we wanted to reduce those mental health challenges by reducing business closures and enforcing isolation. We wanted to reduce that as much as possible. But let me add some other things that we focused on, because one thing, Brooke, that you know that we believe very strongly in the state of Texas, and that is your First Amendment right to freedom of religion. And so unlike what we saw in some other states, we made sure that religious services would never be shut down and people would always have access to things like religious services. And so we took a measured but responsible approach that tried to stay true to constitutional principles, and that would maximize freedom for our fellow Texans. And that is one thing that accelerated Texans being able to get back to work and earn a living and keep our economy up and running.
We've seen record amounts of federal spending and borrowing this year. I'd love for you to contrast, as a governor, I know you've got to balance your budget every year. You can't just print money. So share with us how you have a different attitude about taxing and spending in Texas.
Well, first, the answer to all of this is not more government and expanding more government and more spending, and instead is focusing on, for example, opening up the economy as opposed to closing it down. The best pathway for economic success is through the private sector as opposed to the government sector. And Texas is well known for focusing on the private sector, and that's one reason why we consistently lead the United States, both in things like job creations as well as economic development. We focus on that, but Bobby, you mentioned something that people need to understand, that, and that is on this infrastructure bill, so much of what they're spending money on really has nothing whatsoever to do with infrastructure. And so the federal government has to be more responsible in focusing the spending and targeting it on what really needs to be done. I'm going to give you one quick example that will blow your mind, that shows how the federal government is really straying from their core mission. And that is, as you hear the Biden administration talking about infrastructure, which we think about building roads and bridges and things like that, Texas as a state, we've had a project we've been working on for almost 10 years now that would provide $9 billion of funding for Interstate 45 that runs through Houston, Texas. It was all done, signed, sealed, and delivered and ready to go until the Biden administration took over. And the Biden administration has shut down that infrastructure project, saying that it is racist and violates the Civil Rights Act. A road project violates the Civil Rights Act. So just know, as the federal government is going down this pathway of trying to spend more money on infrastructure, it really is a pathway for them to achieve their Green New Deal socialistic agenda, as opposed to truly building out infrastructure.
Well, Governor, we're so grateful to you. Everything you said obviously rings very true with everything we're fighting for at the America First Policy Institute. Your leadership is so important and will continue to be, I believe, a shining light for this country. And I know the recognitions you've gotten along the way for everything that you've done for the great state of Texas, but truly as a model for freedom and liberty for this country, will continue to be recognized. We hope you'll join us again, and we'll look forward to talking to you so soon. Thank you.
Thank you, Brooke. Thank you all. Take care.
We enjoyed our conversation with Governor Abbott from Texas, and now we're going to have a conversation with Governor Reeves from Mississippi.
We're thrilled to be joined by my neighbor to the east, Tate Reeves, the great governor of the great state of Mississippi. Tate, how are you doing?
I'm doing great. How are you doing, Bobby?
We're doing very well. Look, I'm going to ask you about a lot of things. I'm joined by Heidi. We're thrilled to be talking to you. Thank you so much for taking this time to talk with us. I do want to talk about health care. I know you've been a fierce advocate for competition. You've been a fierce advocate for bringing down the cost of health care, for helping your people. One of the things you championed was this licensing reform. And for folks who don't know this, a lot of jobs require these extra licenses, extra paperwork. And what that does is it reduces competition, reduces access to services. Now, you did this across the board, but it has a particular impact on healthcare. Why don't you tell us a little bit about that? Tell us what you did and why it was so important for you to do that, and tell us what you think is going to happen for the people of your great state because of your reforms.
Well, thanks, Bobby. I appreciate it. Universal licensing recognition is an issue that I have been championing for many years. We've been able to get a little bit of the pie each year over the last 6 or 7 years, but this year we were able to hit the home run. We really were able to get universal licensing, one of the first states in the nation to do it. And what it is basically is a loss for governmental bureaucracy. It's a loss for governmental red tape, and it's a win for our economy.
I want to turn things over to my colleague Heidi. She's going to ask you some questions as well.
One of the things that I'd love to hear from you about is telehealth. And we know that during COVID, telehealth deregulation helped improve access for millions. What impact will that have on your state?
Well, it's going to have a huge impact on our state and for any other state, particularly states like Louisiana, Mississippi, and other rural states. If the governors will embrace it and if they can work together with people across the state to grow it, it's going to have a huge impact. You know, there's an old saying, Heidi, that's necessity is the mother of invention. Well, necessity is also the mother of innovation. And when you live in a rural state, we don't have an adequate number of healthcare professionals in many of those rural areas. And so Mississippi has actually been a leader in telehealth for at least the last 7 or 8 years. This has been one example where because of my ability to expand the ability of telehealth in our state, we've been able to provide more access to care for more Mississippians. And that ability to provide that access to care has shown not only those medical professionals that were somewhat reluctant to embrace it, but also those legislators that were reluctant to embrace it, as well as the general public, where we could go.
Well, let me ask you this. You know, I've noticed as well, and I've praised you for this publicly, you push back against the federal government. Share with us your perspective on that, both as it relates to COVID, but just more broadly, your view as the head of a state and your relationship with the federal government.
Well, the COVID, of all things that have that we have learned during COVID, and this marathon that you speak of feels like a never-ending marathon. But the one thing about COVID is it has really illustrated the differences in the core philosophies of the two political parties in America. The Democrats just absolutely believe in central decision-making authority. That is the reason that they are so strongly entwined in Washington, D.C., because they think all decisions made out of Washington are what's best for America. CDC is a prime example. They have repeatedly, because of their big government philosophy, tried to shame individuals into making what they believe to be the best decision, when in reality they would have been far better off to simply say, here is the information, here is the data, here is what we believe, now go make a good decision.
Yeah, Governor, we just appreciate your leadership on COVID during the past, as you said, extended time that we've been dealing with it. You know, if you were talking to just everyday Americans as well as people in your state, what are your current kind of recommendations of where we are today?
Well, we find ourselves in a very challenging environment, one that even certainly a year ago we didn't hope to be here, but even a month ago we hoped we would not be here. What I would say to people, everyday Americans, is the fact is that Operation Warp Speed produced a safe and effective vaccine. Please look up the information, look up the data. I will defend individuals' rights to make their own decisions long before I will tell anybody what to and not to do.
Thank you so much. Thank you not only for taking the time to talk to us here at AFPI, but more importantly, thank you for your principled conservative leadership, doing a great job for the state of Mississippi and your residents. Thank you so much for taking the time to talk to us.
Well, thank you, Governor. Thank you, Heidi. Appreciate it.
Thank you, Governor.
35 years ago, I came to the United States because I was running away from war and unrest on the country of Guatemala. And I started a small business as a gardener. One day I was working and I felt dizzy and decided I really need to get some help, and I don't know what's going on. I went to the hospital. I wasn't really familiar with the cost of this test that they were doing. And they said, oh, well, don't worry about that stuff. There's financial aid. We'll worry about that later. I wanted to be able to take care of myself, so I didn't say anything else. Within a month after the time I got out of the hospital, I received a bill. I was really surprised. I came to the house and I was almost crying, and I told my wife, "Would you believe this?" And she just couldn't believe it. It was just unbelievable. I don't have a whole lot of money left. I really don't. And so when I look at the $20,000, then I feel, how am I going to pay this bill and be able to help my wife in her condition and support my son? And my wife has been in the wheelchair for 23 years. And all this time, I had to take care of her. So looking at this bill is, how am I going to do this? There's just no way. I work very hard to support my wife and my son, and for many years I have done that. And I'd like to continue to do it, but but it's very hard to do that when the hospital sues you for more than what I make, way more than what I make. It's almost like the system works against you. You work and support your family, you stick with them, and then after you work so hard, if you get sick, then you go there and end up with this big bill that you can't figure out how you're going to pay, and then you lose everything.
Hello. Governor Jindal and I are pleased today to be joined by two really innovative physicians in the country, Dr. Lee Gross and Dr. Keith Smith, leaders in price transparency and direct primary care, and really just providing amazing examples of doctors leading the way with solutions for our healthcare system. So welcome to you both. Glad to have you on.
Dr. Smith, we'll start with you. First of all, it's a great honor and pleasure to have you join us today. I've been a big fan of what you've done there in Oklahoma with price transparency at the Oklahoma Surgery Center. Now, not all of our viewers, not all of our listeners are going to be as familiar as we are with what you've pioneered and how that movement is growing across the country. So could you please share with us what really prompted you to share your prices with prospective consumers and patients? What motivated you to do that, and what are the consequences? What are the results of you making your prices transparent? And thank you again for joining us.
Well, listen, I know I speak for Lee too. We appreciate you guys helping us get this word out because that's the sunlight that will disinfect the cesspool of the industry that Lee and I are trying so hard to change. In 2009, for those that are unaware, I launched a website with all of the prices, bundled prices, cash out the door prices for the surgeries that we performed at our outpatient surgery center. And I did this because it was obvious that the so-called not-for-profit hospitals were ripping people off and bankrupting them. And we decided, we've got control of an institution and we can do something about this and sleep at night and offer people fair pricing. What's happened as a result is astonishing, frankly. I've gone from wearing a tinfoil hat on my head from doing this to now seeing fines levied on those who won't. So it's been instructive, and I feel vindicated and just blessed to practice in this way and not be handcuffed by the mess of the system.
Yeah, well, Dr. Smith, thank you so much for your leadership with that. And, we know that your patients get great quality and have good outcomes as well, which is just as important as having price transparency. So, you mentioned fines being levied on those who do not participate. And, there are new federal regulations with bipartisan support from both the previous and the current administration for hospitals to post their prices. Hospitals, many of them, still are not fully complying. And so I would ask, what advice do you have for patients and doctors who want to more fully participate in systems that are voluntarily offering price transparency?
Well, the message really needs to go out to the gorilla in the marketplace, and that is the self-funded buyer. These are companies that are that are basically buying their employees' health needs out of operating revenue and taking the insurance risk themselves rather than assigning it to one of the carriers or buying it from one of the carriers. They represent the largest buyer with sticker shock in the United States. And when that dragon awakens, then the demand for honesty and an embrace of market discipline it'll change even the current price gougers into those who are trying to deliver value to the buyer. And that's how every other industry works in the marketplaces in the United States. So, with the self-funded buyer is the key. Once they wake up, then everyone's boat will float higher, prices will drop, quality will soar. The bad players with bad pricing and bad outcomes will be disappeared, as they should be. And the marketplace will render its discipline on them and will force them to either change or go away. So I think that everybody needs to know this is possible. It's being done. It's growing at an alarming rate. And when the big companies that are self-insured decide that they want to pay less and get more, it's there for them.
What a radical thought. As we talk about consumer-driven healthcare, a big part of that is you've got to have transparency around price and quality. What a radical thought that patients should know what their healthcare procedures actually cost. I'm going to switch gears. Dr. Gross, you've pioneered, you've been a leader in this field of direct primary care contracting. It's certainly been growing across the country as an alternative to the bureaucracy and the paperwork that you see in other types of arrangements. This is a model whereby patients can pay their doctors directly, see their doctors more frequently. Well, for our viewers and listeners that may not be as familiar with this concept, please, could you share with them a little bit about how this concept works, why you've pioneered this, and maybe your thoughts on why we're seeing such tremendous growth in this type of model all over the country. And again, thank you for joining us today.
Yeah, thanks, Governor. I appreciate me, and I'm happy to have this conversation. The name of our practice is Epiphany, which is a pretty strange name for a company, but in fact, we did have an epiphany, and the epiphany was, why are we insuring primary care? Why are we taking the most basic aspect of healthcare delivery and inserting a bunch of hands that need to be paid and make decisions and control every interaction between the doctor and patient? So in 2010, we decided we were going to cancel our commercial insurance contracts, opt out of Medicare, and we created a subscription-based primary care service that has since become to be known as direct primary care. And essentially, we charge $65 a month for an adult, $25 a month for one child, and $15 a month for each additional child. And after that, we provide unlimited office visits, unlimited technology visits, unlimited in-office procedures and testing. And what happened was we quickly realized that coverage is not health care. And all of these people that were getting, Obamacare insurance cards with these $3,000 to $5,000 deductibles were effectively uninsured. And we were asking them to be responsible consumers in a store that had no prices on it. So these patients found us from all over the state of Florida. So these patients with these high deductible plans, these patients with no insurance, quickly found their way to our practice. Many of the people were falling through the cracks. Many of the people ended up getting Medicaid, and most of the physicians were not taking new patients on Medicaid. And we quickly realized the Affordable Care Act, instead of increasing access, actually really just increased bureaucracy, drove consolidation of doctors into big practices, decreased patient choice, and increased the cost, which is the exact opposite of what we're trying to do. But we quickly realized when we had all these uninsured patients, we needed access to affordable labs, affordable imaging services, affordable physical therapy. And so we shopped around for the patients and created a store that they could shop in to get wholesale pricing. And effectively, we were seeing CAT scans for $175, MRIs for $200. We had the cheapest prices in services in the country. So there were about a dozen of us at the time. We started this in 2010. Fast forward to 2021, there are probably approaching 2,000 independent practices practicing in this model and adding more practices every day.
Dr. Gross, thank you so much for just those details, and again for your leadership as well. You and I were recently discussing the outcomes, both the health and cost outcomes for patients in your practice. Can you just share some of those results along with, increased patient and doctor satisfaction that you've seen in this model?
Sure. As you know, anytime the government tends to try to fix something, they add more layers of bureaucracy, which doesn't necessarily fix the problem. In fact, you're seeing a trend of physician burnout and suicide. And so what we did in our practice is we worked with a rural hospital in Florida. So we've lost over 100 rural hospitals across the country since the passage of the Affordable Care Act due to bureaucracy and heavy Medicaid burden. But this hospital, we worked with them to create price transparent bundles, much like the Surgery Center of Oklahoma. We drew some elective surgical volume that would normally never be done in that hospital, creating some regional medical tourism. And then we worked with the health plan consultants because they already had a self-funded employee health plan, but they were self-funded through one of the large commercial carriers. We restructured their health plan into an independent administrator of the plan, built it around a direct primary care chassis. So if the employees wanted to sign up for our practice, it was at no cost to the patient.
Well, Dr. Gross and Dr. Smith, just such, again, incredible examples of real solutions for the healthcare system. I would just ask if Governor Jindal has any further questions or points that you'd like to make before we conclude.
Well, let me just ask this, and in the few minutes we've got left here, Dr. Gross, as you think about growing this model across the country, what do you see happening? Do you talk to many of your fellow practitioners? Do you see other doctors wanting to do this? What are the barriers? For our viewers and listeners out there that might be thinking, wow, this sounds pretty good. How can they find a doctor, and how can they find somebody in their area? If they're not in Florida, how could they find somebody who might be willing to do direct contracting with them? What do you see as the prospects for direct contracting across the country?
Yeah, there are definitely regulatory barriers. Those are things that we've been working on for over a decade to fix it. And there are a lot of people that don't want to see this succeed. So that growth was despite a heavy headwind. But even that, we're seeing huge numbers of physicians uptaking this model. But I can tell you that from our proof of concept that we now have done, I guarantee you there's no plan in the country that has achieved the success that we have in the second poorest county in Florida. So people that look at this as concierge medicine or elite care, again, we pulled off those savings in the second poorest in the state of Florida. And so that could be replicated in every rural county and save every rural hospital across the country.
Well, great. Dr. Gross, Dr. Smith, just want to say one personal note of thanks to both of you. You've been an inspiration to me, and I know to countless other young physicians early in their career who are looking for other options and looking for careers that really allow them to pursue and achieve what they went into medicine to do, which is to help people and to not get caught in bureaucracy along the way. So you're an inspiration to many, an inspiration to me. We thank you for your time today and look forward to having you back and to continuing the discussion.
Thanks for having us.
Seeing my husband in that much pain, me personally, I didn't know whether he was going to live or die that night.
I was having real bad stomach pains for like a day and a half. Yeah, so when I did go to the hospital, they handed me about 3 sheets of paper. They wanted me to sign before I was admitted. And I was in so much pain at the time. When you're in pain, you just want to get that pain away. And I just signed my name and hope to be seen real soon. I received a bill for $22,000 after being in there 3 days.
And we had insurance, $22,000.
And that was out of pocket.
And when he showed it to me, the first thing I said was, okay, Zach, something's wrong here. We have insurance, we pay every 2 weeks, but yet we received a bill for $22,000.
And summons to go to court for the bills. When I received the warrant to go to court, my emotions was all over the place. Because first of all, it was a warrant, and that's something that's very serious. And for it to be a warrant for a doctor bill, that was kind of unusual and strange to me.
Because I'm getting kind of emotional here. We understand that when you go to a hospital, you're going to have a copay. But what we don't understand is the outrageous cost that you charge the average American family just to seek medical attention. People are afraid to go. because of the bills that they think that they may receive.
Yeah, they're running a lot of people's lives with these high costs that they can't afford. A lot of doctors are good people, and they're here to help people. That's why they got into the profession they're in. But they can't because so many things are in their way.
Hello, Cynthia. It's great to see you. We're honored to have you join us today here at AFPI, and just thank you for all that you've done for me personally. You're an incredible businesswoman, but also an incredible advocate for employers, for patients, and really admire and thank you for your work. So we're really excited to talk to you today.
Well, thank you. It's a pleasure to be here.
Thank you so much for joining us. You know, I want to build off of what Heidi has just said. I know you've been a fierce advocate for price transparency, and I know that one of the things that motivated you to get involved and become a leader in this area is your own personal frustrations with covering the healthcare cost for your own employees. Could you talk to us about that as a business owner, as an employer? Tell us about the challenges of covering those healthcare costs.
Well, I'm glad you asked about that because, the reality is that I had started a business in 1992 in the medical arena, and we were transparent with quality of our cord blood stem cell collections as well as outcomes when they were used in transplant. But moreover, from the very beginning, we were also price transparent, and we provided one price, one patient, all patients. So that was financial certainty that all of our clients and patients got the same exact price. And I knew this could be done because we did it. And also as an employer and as a business owner of thousands of employees, every year we see, like ourselves, high single-digit or even double-digit increases in our coverage. And this has been going on over the past decade especially, which has really suppressed wages because of the double-digit increases in coverage costs as part of our health benefits. So we know that we've studied employers across the country that directly contracted with price transparent physicians like direct primary care doctors, as well as surgical centers that went out and were price transparent, just like the business I had founded over 30 years ago. That said, we have seen that employers, and now we ourselves, by contracting directly with these price transparent providers, sometimes they are 1/6 of the cost of the opaque hospital system. And what we've found is we've been able to save, but the employers that we've looked at contracting across the country, by year 2 or 3, they're saving 30 to 50%.
Well, thank you, Cynthia. In addition to your experience, like you said, the experiences of other employers and your work in collecting these stories has been so important in helping Americans understand this aspect. I was wondering if you'd be willing to share with us one or two of your favorite impact stories from employers.
Well, I think there's an exciting one happening right now, and they're in year 2, and that is Osceola School District down in the state of Florida. And the teachers had among the lowest salaries in the state. It was difficult to get the compensation. And why was that? It was because they were experiencing north of 11% increases in their healthcare costs, which had not enabled them to be able to raise wages. Well, they left their major plan system and instead went into an RFP and worked with a third-party administrator to create an employer type of plan that then could directly contract and help steer employees. Well, in the first year, they moved their annual cost they saved $6 million from their annual cost of $72 million. And right now on this year, they're on target to save 15+ million in year 2. That's huge. That's momentous. And this is one of those success stories that you could imagine as we move to this price transparent model and employers shift to create their own health plans, to contract to have that financial certainty and savings for their employees. You can imagine what it can do across our country.
The contrast is so startling to me. You look at certain polls and surveys, so many large employers, when they look at the frustration of healthcare, you mentioned these double-digit increases year over year. I know many companies just are throwing up their hands and saying, we just want the government to do this. You know, even some folks that are normally pretty much for less regulations, less taxes, less government spending are saying, we don't want to deal with healthcare. It's too complicated. It's too expensive. And a lot of these big, larger employers are saying, let the government take it over. What advice would you have for them? You've been an advocate for things like price transparency, like direct primary care contracting as real alternatives. What advice, as an employer, as somebody who's started businesses, helped to run businesses, served on boards, you know this world better than most. What advice would you have to these businesses that are getting so frustrated with healthcare?
Well, Governor Jindal, you know, I think they're right to say, look, in the world in which we lived before, the dark ages, which I would say it's because we would have been kept blind as employers to knowing the prices. We've been kept blind to actually seeing the cost negotiated rates from the insurers. And then oftentimes we have to pay with a blank check, as do our employees, whatever the hospitals choose to charge us. But that's all been pulled back. Those dark ages are gone. So now we are at this inflection point where we can give the free market a chance. And that is through 3 presidents. You know, the Affordable Care Act from Obama gave what President Trump put in place of using the rights for patients to see all prices before we get care. Okay, so these price transparency rules from the hospitals and starting next year for the insurance companies, that pulls back the curtain and shines light. We're out of the darkness, right? We're out of the dark ages of not being able to manage our health care like our supply chain in our businesses. So once this data is unleashed and hospitals comply and the big insurance companies comply to provide all of these negotiated rates, then all of us are going to know what we're going to get and at what price. And that's huge, because then we can steer our employees and utilize competition and the free market. This is really the first time with these rules in place that both hospitals and insurance companies have to compete like every other one of our businesses in every other market economy.
And we've talked about, you and I and Governor Jindal and I, we've talked about empowering the consumers, the employers with real information. One question I have for you is, beyond price transparency, what are other opportunities that you see for the healthcare system to empower the consumer?
Well, price discovery will usher in quality transparency and outcomes transparency. And already we're seeing companies that are providing employers with tools to be able to see transparency by every surgeon, medical center, and look at what is their readmit rate? What is the success rate of that knee replacement in one hospital A versus hospital B? Infection rates per medical ID per surgeon. So when this is pulled forward, we know employers that are creating these health plans are all ready to contract companies to give them this data. And you can imagine, then we can move this type of data into the consumer's hands as we could shop online, much like Amazon or Yelp or any TripAdvisor. Any of these types of tools tell us what we're going to get, what's the quality, what's the price, and then it's our choice. And transparency will usher this in.
If Governor Jindal has any final questions or comments.
Well, look, first of all, I want to thank you for taking the time to talk with us, and certainly your enthusiasm, your knowledge of the subject area is very, very impressive. You made a very important point. I want to make sure that we reiterate and emphasize this for our viewers, our listeners out there. We have not been living in a competitive healthcare marketplace. I think a lot of us, everybody can agree that what we've had previously was broken. And I think the left simply offers more government control as the answer, and that's not the only solution. And I think you made that point very well, that what we did not have a consumer-friendly healthcare market. That's not the comparison. The comparison is what we could build with this transparency, with this competition. And I think you're right. If we don't build that, for those of us that believe that's the better way, it's incumbent upon us to build that, because the alternative is going to be more and more employers simply shrugging their shoulders, giving up and saying, let the government take care of it. We can't deal with this anymore. And so I really appreciate your taking the time. I think you've got a unique experience. having started those businesses, having been an employer and serving on those boards. I will give you one final question, one final opportunity to share your thoughts. So as people listen to you today, as people are hearing and are excited about this, what can they do? You know, if you work in an organization or if you're an employer and you want to make the kinds of changes you described in Florida and elsewhere in your businesses, what can they do to help get more control over their health care? What are some specific things that our viewers could do?
Well, I think as any employer can really shift to look to working with third-party administrators that help them educate their employees to become consumers of healthcare, and then rewarding the employees with bonuses when they're able to shop and get a better price than even what they have as a negotiated rate price today. And so as we go forward, all of us can demand the prices because it's our right. It is now our right. And that's a huge win. And oftentimes the discounted cash price to pay directly with cash, that eliminates all of the administration needed for collections and billing. So the hospitals make money, they get their money right away. And the employers actually save by directly contracting with surgeons, surgery centers, and hospitals. And when an employee can get an MRI price for cash for $450 for a 3 Tesla MRI, say of a broken right hand, and they can go and get that for $4,500 at a hospital's rate for their insurer. When you save that 10 times difference in money, the employers could totally reward their employees by helping them get bonuses for the percentage of savings that they've done for all of the rest of the plan members to drive down those costs, and then pay that lower cash price all in because it's such a huge saving. That's just one first step, but it's a moment in time where the CEOs and the CFOs, it's a call to action because now we can start to manage healthcare like we manage our supply chain.
Well, Cynthia, we want to say thank you so much for joining us today. Thank you for your insightful comments and leading the way, especially for employers, but also for patients in championing price transparency and other reforms. So we look forward to continuing conversations with you.
Thank you, Heidi. And you know, it's not going to be easy in these early days, right? But when these tools come online, it will continually get easier. And this is a great win for the American people. And thank you, Governor Jindal, for all that you've done to contribute to this policy.
Thank you, Cynthia. Thank you very much.
Thank you, Cynthia.